So we're going to talk about existentialism and mental health, particularly psychiatry and psychotherapy. Um, there's two poles, two extremes that I think existentialism is trying to fall somewhere between. I mean, non-existentialist approaches as well, but on the one hand, you've got this reductionist approach, which, basically just sees the mind as the brain and thinks of any kind of mental health issue as primarily a problem of brain chemistry, or it might be some other impairment of functioning of the brain due to like brain injury or a hereditary condition or something like that. So the appropriate treatment would be to just to readjust that brain functioning by the appropriate medications, etc. So knowing about the person's life story, their childhood, the circumstances they're in would be pretty much irrelevant. You just need to fix the brain, right? And the romantic side, tries to see mental illness as something that's not necessarily a negative thing. Like even that term mental illness, they might object to. Say, like, some people think differently, and because of societal expectations, they're characterized as mentally ill. And the romantic view tends to say, like, well, if we just allow people their different ways of expressing themselves and, just see these as alternative possibilities of how to live your life, then, then they might very well flourish. Now, I think both of these have their pitfalls, so we'll talk a little bit about the pros and cons of them. Historically, existentialism has veered more toward the romantic side, which is not surprising because we've seen how much the existentialists prize individuality and creativity and, their emphasis on the absurd. So they say, like, being out of step with society is not necessarily a sign that there's something wrong with you. It might be a sign that there's something right with you, and you should just be allowed to do that. But there is a possibility of just taking this too far, right? And I think the example of a Kingsley Hall, R.D. Laing was a therapist who was influenced by existentialism and also influenced by just his horror at the ways that psychiatric care was provided in his time. So we're talking about, in the 60s here, he was disgusted with the frequent use of electroshock therapy and, drugging people with what were some pretty strong tranquilizing drugs as a treatment for schizophrenia. Or other types of mental illness. Now, Lang's view was that instead of these kind of harsh interventions, the best thing to do is just allow people to kind of like live out their lives, to express themselves through art, and to, just give them nurturing support rather than medicating them or subjecting them to like any kind of invasive treatment. Now, that's admirably empathetic and humanistic, but you might say, well, aren't there some people who really need medication who would benefit more from receiving medication than not? And, just letting people, do whatever the spirit moves them to do can be very dangerous for somebody who's seriously mentally ill, like they might be a danger to themselves or other people. And certainly that was the case with the Kingsley Hall experiment, is there were residents there who subjected themselves to extreme starvation or other kinds of self-harming behaviors, and who were very volatile and dangerous to others. So, and you might say too, this whole idea of the artist as, having divine inspiration, it might, for one thing, it might not give due credit to a lot of like perfectly sane artists out there who are able to create great work without necessarily fitting that stereotype of like the mad genius. So those are some worries about this kind of like romantic view and the problematic lengths to which it can be taken. On the reductionist side, I mean, we can say on the one hand, for certain, our advancing knowledge of how the brain works has been enormously helpful in understanding things like anxiety, depression, etc., and how to treat them. But we could worry about the reductionist view failing to look at the whole person, you know. Facts about that person's life and experience may be relevant, you know, just to say, like, oh, you've got this chemical imbalance, may not take into account what that person is dealing with. It may not take into account the fact that variations in your level of contentment and your level of anxiety, etc., are a normal part of life. You know, there are difficult times in life, there are difficult situations that we all face. I mean, I've been reading somewhat about this you know, the state of mental health in the United States, and because of the way that people are isolated and because of their anxiety about the pandemic and, you know, uncertainty about what the future holds, there's a lot of anxiety. People are experiencing a lot of anxiety and a lot of depression. But also practicing a lot of substance abuse as a consequence of that is a way of sort of self-medicating. Now, you might say, is that mental illness, or is that just a reasonable response to a very challenging situation? So those are some things to consider when looking at the drawbacks of this reductionist point of view. Also, too, we might worry that, you know, just medicating away anything, like if you feel grief at the loss of a loved one, you know, maybe that's not something that should be medicated away. Maybe that's something that a person really needs to experience in order to go through that process of grieving and to feel like that has been resolved for them. And again, I would say, just from personal experience, when you lose somebody who's close to you, you know, it's never something that you completely forget. It's always going to be a part of who you are, but it might not be as intense as it is in the initial period of grieving. So the criticisms of reductionism focus on the fact that you need to look at the whole person. You need to look at what their personal experiences are, how things are from their perspective, and the environment they're in, the environment that they had growing up and the environment that they're in currently, to fully understand what's going on with them. Just treating them as a organism that needs to be rebalanced chemically is insufficient. And sometimes this criticism gets focused on the DSM, you know, the Diagnostic and Statistical Manual of Mental Disorders. Now, there's been many iterations of the DSM, and a lot of professionals find it extremely helpful. And also, too, I think I want to give due credit to people in the mental health profession that, you know, I think that there's many therapists and mental health practitioners who really take the time to try to understand a patient in context and understand whether what's going on with them is causing them any kind of impairment of functioning, and not just like going down a checklist. But the fact of the matter is, there are a lot of people who have been misdiagnosed, who have been given medication based on wrong diagnoses, and there is a concern that the DSM maybe makes that easy to do because so many of the diagnostic categories are open to interpretation. So one criticism would be that it just kind of pathologizes any deviation from what's considered normal or optimal behavior. So, you know, it's too easy perhaps to get a diagnosis of generalized anxiety or attention deficit hyperactivity disorder and to get some kind of medication for that, rather than kind of like looking at what might be some lasting changes that a person could make to improve their functioning in life. Now, when we've been talking about existentialism, anxiety, depression, dread, anguish, those have all come up as important moods from the existentialists' perspective. And also, they've talked about the importance of existential crises. Is like, there are times when you'll be going through your life and you're just kind of confronted with the realization that maybe you haven't really been living as authentically as you might, or that you're not sure that the choices that you've accepted unquestioningly are right for you. And I think from the existentialist perspective, again, this is not something that needs to be treated. This is not a disorder. This is not something that calls for medication. This is something that calls for an examination of your life and your choices and an assessment of where do you want to go from there. Now, I want to mention a particular researcher, Matthew Ratcliffe, who has used existentialism and phenomenology and directed them toward the study of mental health. So, in particular, he's looked at the experience of depression, the phenomenology of depression, and I think that can be a valid and useful contribution to the field of mental health. And I think that too, it intersects with this existentialist concern with phenomenology and embodiment. In the treatment of trauma, one of the things that has been important is allowing the person who has traumatic memories to ground themselves in their situation by paying attention to their senses. So it might be by noticing objects in the room when they're confronted with a traumatic memory or with a dissociation event, or it could be touch, it could be sound. There's a lot of different procedures that have been used and have been successful in helping people to deal with traumatic memory. Also, too, there's been a growing interest in terms of the treatment of addiction. So clearly addiction is a huge problem in the United States and elsewhere. And, you can say like addicts, they're just not acting in their best interest. You need to, just point out to them that this behavior is not going to lead to a good path. But that doesn't seem extremely effective. A person can know full well the problematic consequences of addictive behavior, but persist in it anyway. So one approach is to look at the phenomenology of addiction. Like, why do addicts do what they do? Why do they choose to go back to a drug or a substance that they're using, or a behavior? In the case of behavioral addictions like gambling, when all their past experience has shown that this is just going to cause more problems. So you really need to understand, what drives a person to engage in addictive behavior if you want to change that behavior. All right. And the kind of interventions that are going to be most successful are those that are going to take into account what it's like to experience addiction and how to transition to lack of dependence on that substance or behavior in a way that is going to work for that person, rather than just assuming that reason alone is going to handle it. There's another domain where existentialism comes into play, and that's with various types of expressive therapy. So we've seen this particularly with art therapy. There's an assumption in existentialism that creativity is a way to express oneself, to convey difficult emotions or convey things that it might be hard to communicate in words. And particularly, I think for young children who have a difficulty explaining their circumstances to another person or to an adult, this kind of therapy has been quite successful. But for people of all ages, various types of expressive therapy involving art, involving movement like dance, that involved acting things out or writing things down, have been effective in providing people with an outlet to deal with, or a way to communicate what they're going through. So those are some of the concerns or some of the places where existentialism has interacted with mental health issues and the treatment of mental health. I encourage you to take a look at Maddie's presentation that's posted on Canvas that talks about existentialism and mental health. Now, I asked the question at the beginning of the semester, is like, would existentialism even exist if people like Kierkegaard or Dostoevsky or Nietzsche had been medicated, if it had been available in their time and if they'd been willing to take it, like, would there even be any such thing as existentialism? You could see existentialism as, a manifestation of untreated mental illness. And I mean, I think there's like some truth to that. I would say that, if some of the founding figures in existentialism were treated today in a contemporary mental health setting, they would be diagnosed as having some pretty serious disorders. But I mean, I really do think there's some wisdom to the view that life is challenging, and we're all going to have times when we experience anxiety, depression, where we experience something along the lines of an existential crisis, and that shouldn't be seen as evidence that there's something wrong with me or something wrong with you. That's inevitable with the stresses and the challenges and the uncertainties of life, that we're gonna sometimes not feel good. So I think the real challenge is finding a balance between the extreme reductionist approach, that just looking at us as brains that need to be made to function properly, and the extreme romantic approach, which thinks like, just let it go, let it be expressed in whatever ways, which could pose a real danger for the individual. In any case, I hope you all are doing well mental health wise. It's a difficult time, and I've appreciated having the opportunity to interact in this class with y'all. Let me know if you have any questions, and I will talk to you again soon. Thanks.